Hi, how you going, Sally?
Good, Ben.
Welcome along. Thanks for having us here today at Liverpool.
Pleasure.
Sally Walker's one of the eMed's project managers, has also been involved in the Telehealth Project. We're just here today to talk about your thoughts on how the Telehealth Project's rolled out and the benefits it's given to the staff there. So why did you pick HPA?
We have used HPA products across a few of our different projects up until the telehealth and COVID really hit. So we have a lot of HPA products across all of our hospitals in Southwest Sydney. We've always found HPA to be really responsive to the needs and they really listen to what we're trying to achieve. And then we were able to retrofit our existing carts with some technology to assist our clinical care. Yeah, so it really goes all from right from clinics right through to our inpatient areas. So the primary need was in the intensive care and ED space, where we really needed to get consultation from medical teams across the district, where we were trying to minimise that face-to-face contact and the COVID spread across our staff. So we were implementing the cameras and the speakers onto our existing carts so that we could use Skype and PEXF accounts to do medical consults, but also to increase our patient interaction with their relatives as we had restrictions put in place with visitors coming in.
Patients who had COVID and were in this ICU, we had restrictions on visitors coming to see them, obviously for the sake of the visitors themselves and also for the sake of the staff. So to try and get the visitors or the patients' families and their close ones to communicate with the patients, we used this telecard. So we put this telecard next to the patient, got them onto PEXF, sent the PEXF link to the relatives, and they were able to log on and see their loved one.
Right.
And this is when they were on sedatives and in an induced coma and very sick.
Mm-hmm.
As they got better, the patients could communicate and talk to their relatives. So what we were trying essentially to do is to simulate or to do exactly what we do in other situations, is let the relatives visit their family and spend time with them, because we find that medically with treatment and injections and tablets and so on, we can get people better physically, but the emotional, the social, and the psychological well-being is as important, and communicating with the family certainly helps that. And as patients get more awake and are able to interact, it helps their mood, helps them engage in treatment and get better quickly. So the workstation on wheels that we used really helped in that part, but we found effective that the use of the workstation on wheels was very effective, and that when people engage in it, they find that it helps the patient, it helps the carers, and it helps health professionals. So certainly it's something that we would continue to use in future to help our patients through their journey through ICU, because as you know, in ICU, patients are very sick, and trying to look after them and trying to engage in a whole of health or a whole of family type of approach in getting people better, this kind of technology is very helpful.
Fantastic.
We had good positive feedback about being able to access their loved ones in the clinical area but not having to come into the hospital.
Yeah, fantastic.
Yeah.
Good for everyone, I guess.
Yeah, and then with the clinics, we looked at our high-risk patients where we really wanted to minimise their contact in the hospital environment. So we looked at the clinics that would best suit telehealth model of care, so that we could still provide care to our patients, but they could be safe and in their homes.
Yeah. Oh, that's great. Well, look, thanks for having us here today. We really appreciate it. We look forward to working with you more in the future and providing more solutions for Southwest Sydney LHD over the coming years.
Great.
Thank you.
Thanks, Ben.
Thanks, Ellie.